As Nigeria joins the rest of the world to celebrate this year's World Blood Donor Day, the National Blood Service Commission and the World Health Organization have urged African governments to prioritize adequate resources to provide blood transfusion services. Arise correspondent Benny Ark tells us more.
On June 14 every year, the global community marks the World Blood Donor Day to focus on the gift of life from voluntary, unpaid blood donors around the world. This year's theme, Donating Blood as an Act of Solidarity, Join the Effort and Save Lives, highlights the critical role of voluntary blood donations in saving lives and enhancing community solidarity and social cohesion.
Today we are celebrating the World Blood Donor Day, a day that has been set aside to thank those who voluntarily donate blood to us, to appreciate all their efforts and to be in solidarity with them. What the agency is doing is to sensitize, to advocate, and to enlighten Nigerians on the need to donate blood to save lives.
The major issue is that while there is a universal drive for blood donation, access for everyone who needs it is still limited. In Nigeria, with road traffic accidents, insurgencies, and other crises, demand regularly outstrips supply, negatively impacting timely access for all patients who need safe and quality-assured blood to save their lives.
By the World Health Organization standard, every nation is supposed to have 2% safe blood of their population. Nigeria being at least 200 million, was supposed to have at least 2 million safe blood units at any point in time. As I spoke to you, we are not able to get up to 20% of that.
As a consequence of the COVID-19 pandemic, voluntary unpaid blood donations dropped significantly. In Nigeria, mobile blood donation drives declined by 100% in the first 2 months of lockdown in 2020. While the number of blood units screened declined by 11.8%.
It's still very low in terms of this voluntary blood donation. We are still just about 8%. That's very low. And a day like this, that gives us an opportunity to increase our advocacy and to get more people on board, particularly young people. Who are still active, who are agile, healthy, so that it can be, and like someone said, it can just be a hobby.
The situation that we have been seeing after the COVID pandemic is really a decline in the voluntary donations. That's why it's so important that we really sensitize the entire community and everybody, because at certain points this is a benefit that will go for the entire population. WHO is working globally to create awareness of the importance of it, and also we are helping concretely in Nigeria to increase the quality. Actually, during this month we are going to start an assessment in which we are going to detect how the blood donation is working in Nigeria, and we are going to also improve the quality of data and the service that is provided.
WHO Nigeria, with support from WHO Africa Regional Office, is providing technical support to the country in the implementation of national blood transfusion strategy, quality management systems, and strengthening the legal and regulatory framework for blood safety. Benny Ark, Arise News.
Well, the Director General of the National Blood Service Commission, Dr. Joseph Amedu, joins us now in the studio for more on this. Thank you so much for joining us. It's been a busy day for you. We appreciate the work you do. But when you look at the observance, the theme of the observance for the day, it highlights that we all have a role as a society to play in donating blood. But how would you describe the level of understanding when it comes to blood donation in Nigeria? Where are we?
Thank you very much. Good evening. Like you have rightly said, the level of blood donation in Nigeria has been very, very low, but currently it's coming up because we have intensified on the level of sensitization, enlightenment, and advocacy to people. And Nigerians are beginning to understand that there's a need to voluntarily donate blood instead of the commercial donation or family replacement. Because I've come to know from studies and experience that when people donate blood through commercial venture, those bloods are not usually safe for transfusion because those who are donating voluntarily are in good health because they live a kind of a lifestyle that is in tune with good health. But when those are sells blood, definitely we cannot cannot guarantee the safety of the blood. Therefore, we advocate that people should voluntarily donate blood. And Nigeria has a large population of the youths. So these youths are a group that we are trying to penetrate through advocacy and sensitization. And we are working with implementing partners who are assisting us to make sure that this is done very well. WHO is doing wonderfully well in this aspect, and other partners are also helping us to ensure that we go into real advocacy to convince people through education that donating blood safely is the best option to go.
All right. Now, clearly, this year's theme says donating blood is an act of solidarity. Just for us to push that message out there, just help me understand this. A publication in 2021 did say that 95% of the blood units used in Nigeria are unsafe. And then they also gave reasons why this is. They said poor infrastructure, inadequate regulation happens to mar the provision of safe blood in Nigeria. I'm just saying that in a situation where Nigeria is said to need about 2 million units and we're producing about, say, 25 to 30,000 units, help us really understand why there is that need for voluntary blood donation, but also speak to the fact that what we are producing at the moment, they say, is not really safe.
Well, like the theme goes, donating blood is an act of solidarity. I know when you are in solidarity with somebody, it means you are feeling the same way the person is feeling, empathy, how you can be part of what he's doing, how you feel, so that you'll be able to, if it's possible for you to take over whatever body the person has, you are in tune with him. Now, in terms of the quality of blood that we produce in Nigeria, I think that because government has identified that there's a need to provide a safe quality blood for the country, that's why there is now an agency by the Federal Ministry of Health called the National Blood Service Commission. This will be a small service point, but now government considers that it's important that we produce actually critical commodity for the health sector. And again, like I said before, when people donate through commercialization, you can't guarantee the quality of blood you are taking from people, because some of the blood could be
infected. Speak to the infrastructure.
Well, infrastructure-wise, yes, Nigeria is coming up very well, because now we use high-tech technologies to clean our blood. We use, in fact, we've gone as far as using Architect 1000 SL a machine to screen our blood. So we are actually top in terms of that. The commission is doing that. And that's why government has also put in place a policy that no more rapid screening for the country, because most facilities, they use rapid screening and they don't actually catch that germ that we're looking at. And so government has now abolished the use of rapid screening, and we think that anyone who wants to go into blood services must tune in to using high quality screening method.
Well, thank you so much for that clarification. Clearly a far cry from where we were in 2021. We're speaking to Director General of the National Blood Service Commission, Dr. Joseph Amedu. Thank you so much for joining us.